Hi, hello. My name is Joseph Jones, and I'll be speaking about the lead catastrophe that occurred in Haina, Dominican Republic. We're going to learn about the following objectives. We're going to learn why Haina, Dominican Republic is considered one of the top 10 environmental disasters in the world. We're going to learn what blood level are considered safe for lead and which ones are considered dangerous for lead. We're also going to learn about some of the various health effects the community suffered from the lead poisoning. We're going to study some graphics based on studies in this community and learn about the variances of lead, and then we're going to summarize this information at the end. So, table of contents. So, Clary just went over the objectives. We're going to spend a brief amount of time on the background. The study focused on Haina and Barsequio in Dominican Republic. So, we have some comparison data for those regions. And then we're also going to look at the percentage of lead before and after the factory Metaholoha closed. And then we look at some additional harmful substances that were also found in Haina, and then we look at the change of lead levels within a decade, and we summarize this information and touch base on the references briefly. So some background. So in Haiti, Dominican Republic, there's a company called Metaloha that is a battery factory, and they unfortunately inappropriately dispose of their batteries. And so then what ended up happening is that the soil became contaminated with lead, as did the air and also water, because the community next to this factory was at a lower level because the factory was on a hill. So when there was rain, the water runoff ran into the community, and also kids played around that neighborhood a lot of the times. So unfortunately, many kids were poisoned with lead, and they suffered from cognitive and neuropsychological problems, as well as physical ailments as a result of the lead poisoning. So in this slide, we do see pregnant women and children who were lined up for lead testing. This was a blood lead level testing, and then on the image of the lower right hand corner, we do see an image of how this community, the Metaloha, disposed of the batteries. And as you can see, it basically was a junkyard. So then in the study, they studied the lead level content of children in Haina, and then of another town called Barsequio, which was far enough removed from the factory that they were considered the control group. So lead level content is considered at a safe amount when it's below 10, which is designated by the blue area in this pie chart. Now, as we can see in Haina, only 3% of the children had lead levels low enough to be considered safe, while in comparison in Barsequio, an overwhelming 42%. So clearly, this community, Haina, is already suffering disproportionately of lead levels. And then they also have a high percentage of lead levels of 20 at 68%, which is a high amount of percentage of their population. These children would need medical intervention, while in Barsequio, it's only 26%. Ideally, it should be zero, but it is significantly lower than Haina. And then, alarmingly enough, about a quarter of Haina's population had lead levels content at 99 plus, which is extremely dangerous and would need immediate medical attention. While we can see in Barsequio, there's no data collected on children who had 99 plus lead level. The highest level of data they were able to collect was 20 plus. So this just shows how disproportionately Haina's community was poisoned because of this battery factory in a proper use of disposal. And so then if we look at the statistical values of the lead poisoning, we see that in Haina, the value was about 60 as compared to Barsequio, it's 10. 60 is extremely high. Barsequio is at least at the cusp of what is considered safe. It should ideally be under 10, but at least it's not 60. So these children were suffering. And then what's even more alarming, that the maximum lead level content they found was 234. That is extremely high. That is 20 plus times what is the safe value of lead. These children this poisoning was detrimental on so many levels. While in Barsequio, it's still way too high, but it's 54 and not 234. So the discrepancy is quite obvious, that this community suffered immensely and were honestly just poisoned, and it's terrible. And so initially, the study was conducted in March 1997, and they came back again in August 1997 to do a second round of studies. So we have the timeline frame of the blood levels at both testing sites. So in March, when they tested, Metaloha was still active, and shortly after they published the paper, they closed down. And then it came back in August 1997. So this is after it closed. So we'll see that even though after the blood lead level content still rose even after it closed, with the exception of the higher levels. And this is because even though they closed, they still did not properly dispose of the battery equipment, and lead was still contaminating the soil. There was still water runoff from the rain. Some of this lead they just buried, so like the area was not cleaned properly, and so unfortunately, people still suffered the detrimental effects of this poor waste removal, and we're still being contaminated with lead and suffering, and it's quite unfortunately, we see this. So proper disposal of battery waste or anything that can lead to lead contamination is extremely important. And then in 2004, another study was done and found some additional contaminants in the soil. So that'll be formaldehyde, lead, of course. Ammonia is also a little bit alarmingly high, and then sulfuric acid. So this area was just a contaminated area. It was just no place to live. And even in the study conducted in 1997, they actually recommended moving the entire community because that would be safer for them than the time it would take to actually restore the community. So this was unsafe. But unfortunately, this was, a poor neighborhood, so this community had to stay where they were at. And so then, if we look at the changes in lead levels over the course of a decade, we see that in 1997, 91% of the children had dangerous levels of lead, as defined by WHO, which we saw in earlier data. And then in 2006, we saw that 50% of the soil was contaminated with lead. So there is a decrease, primarily because after much debate, Meta Loha did decide to come in and actually rectify and clean up the community. So they spent about $500,000 to clean up the community, and Dominican Republic did put in some policies in place to help clean up the community with environmental practice. So the community is under restoration, but these levels, they're still too high, and these children, this community, disproportionately suffered health effects because of this corporate company's improper use disposal of batteries. Due to the controversy, Metaloha have renamed themselves as Metero, and their company now does spend $8 million to ensure that their battery waste products are disposed correctly, environmentally friendly. So that was the one positive that came out of this, that now a company is properly disposing of harmful contents, but this community still suffered the brunt of that. So in summary, today we learned about the environmental disaster that was Haina, Dominican Republic, because of the improper disposal of battery by Metaloha. We learned that the children bore the brunt of this improper disposal because of very high levels of blood lead level, which leads to very, very bad health conditions. Cognitive functions are impaired, neuropsychological functions are impaired. They suffer from physical ailments. And even though eventually cleanup efforts were made and the community is becoming more restored, it is still much too high. But restoration is in progress. So thank you very much for listening to my presentation. I hope this was educational and that you learned some new things today. Thank you.